Another example is aspirin. Aspirin, in fact, is originally from a plant, Wilgebach. So it developed from the Wilgebach. It has further developed in salicylic alcohol glucose, and then it has a lot of number of targets. The mechanism are not well understood and would not be discovered by high throughput screening, because here you can see the aspirin from Wilgebach, Kleckbach, and they have isolated the salicylic alcohol glucose, and afterwards with chemical modification to become salicylic acid. So here is a step from salicin from Wilgebach converted to the salicylic acid. So this is all the chemical structures, and then later on this glucose being cleavage, and finally to become salicylic acid. That is our aspirin. So the aspirin bioactivity is quite in treatment of pain and fever and inflammation, even in heart attack, stroke, and chest pain, and other uses, especially for prevention from colon cancers, has been now practically used by doctors for different patients. So it's actually mainly very active way is to inhibition COX-1 and COX-2 pathway, and for the prostaglandin, therefore treatment of inflammation and all different therapeutic effect. But the aspirin has also side effect and it's also contraindications, especially they induce the stomach discomfort, heart burn, and nausea. So in fact, they also induce stomach bleeding. So many people, when they use aspirin, they cause some stomach bleeding, and all other side effects. So we look at another Chinese herbal plant extract. So it's from the extract of root of Panax note ginseng, and it containing actually an RG1, RE, and R1. So altogether it's about almost 70% PTS. So you can see this is extract from the note ginseng root, and when it's in inhibition from arachidonic acid to the inflammation, so this is the pathway aspirin is blockage, and therefore aspirin also block the production of the prostaglandin 2, which also is a gastric mucus protection, while the PTS from note ginseng, their blockage is at this stage, so therefore they immediately block the plaque forming and also for treatment of cardiovascular cerebral disease is a better treatment strategy than aspirin, because the aspirin side effect is due to this pathway. Another example is to show that artemisinin has been isolated from Artemisia aurora. So this is from Professor Yu Tu in Chinese Academy of Chinese Medicinal Science, who won the Nobel Prize in 2015. In fact, she said she was inspired by the old Chinese ancient book. Here I list the 3 books. Is about 150 to 280 years or to 707 years, which they describe of treatment of malaria-like disease. At that time, it's not called malaria, it's called hot and cold fever, and they use typically this herb for treatment of this disease. So therefore, Yu Tu said the discovering of artemisinin against malaria is gift from Chinese medicine, because he used the Chinese ancient book, inspired by the ancient book, so she isolated artemisia from Artemisia aurora. So when we look at the Western medicine and Chinese medicine, there are different perspectives. So Western medicine is more reductionistic, but it knows the mechanism, emphasized on single target single defect, and most of the time it's one size fits all, while Chinese medicine is more holistic as a treatment of whole body's energy balance. It's for the personalized treatment, focus on health and prevention, especially taking consideration of synergistic effect of different components. So the two concepts are complementary. When combine them, maybe is the best way for treating the patient to get improve of quality of life. So this can be symbolized by this cartoon when we see reductionistic versus holistic. So when you look at this gentleman using very advanced instrument, looking at in universal what's happened, without his wife's warning, he will lose one of the falling star information. So therefore, combination of the reductionistic and the holistic together is the best approach for treatment of disease for human health care. So when we look at the quality control from plant to pharmaceuticals, so you have herbal drug and you make herbal drug preparation, and then you finish the herbal medicinal product. So here example, we start with the root of the Dioscorea nipponica, and then we made the extract, and finally we made a capsule for treatment of pain. So that means the whole production from growth of plant is GACP, and the manufacturer is GMP practice. And of course, we need also for the GACP and also qualified person and manufacturer license. So the whole package is making from plant to pharmaceutical product. So here I want to give an example of ginger. So ginger is a family from the Gingiberacea. So most of the time the root of ginger is being used as a herb, but also as a daily food. Nowadays, even in the cafe, you can ask ginger tea. But the history of ginger, in fact, in China, it was already the 479 BC in the Confucius statement and in 论语, and he already mentioned about the use of ginger. In fact, the ginger originated from the southern part of Asian China, spread to India, and trade from India to Arabia and to Egypt in Han Dynasty. That was about 207 BC. So this is the Silk Route to show the spread of ginger. And in fact, nowadays in Western world, we also use ginger for treatment of different discomfort, especially for treatment of the, in fact, you can see in European Medicinal Agency, in their monograph, they have also used ginger for treatment of the nausea, vomiting, and also the quality has been described by the European Pharmacopoeia for the ginger. And here, one of the study I have conducted. So in fact, the clinic study of ginger as treatment of chemotherapy-induced nausea and vomiting. So you can see, in fact, I have studied more than 20 literature study, but here I put no benefit effect observed, benefit effect observed. Here I will show, here on the left side, we show the 4 articles, 4 publications, shows the no benefit of ginger for treatment of the chemotherapy-induced nausea, while the right side I have 3 articles shows different amount of patients for treatment of cancer. They have a benefit effect. So why in the literature sometimes we have no benefit effect, sometimes we do have a benefit? When we look at it in more detail in all this study, only 1 paper on the left column and 1 paper in the right column, they have described how to make the ginger product. So the quality of ginger is very important. Without having a good quality, clinically you cannot demonstrate the effect. Like ginger, we have some literature said no effect, other literature said it has effect, But if we do have good quality control, standardize the extract, we should have better effect.